The second thing I want to talk about is stone management. And really, we got the latest and greatest technology at Titus. It's called the Lumenis Laser, and I tell you, this machine costs about $200,000. And what can it do for you? Let me show you. You know, a traditional way we treat stones in the urinary tract is with a procedure called ureteroscopy. And we take a lighted instrument through the urethra, into the bladder, up the ureter tube, identify a stone, and use a laser to break up the stone into little fragments in a little basket to take it out. You know, so there's been an evolution in the thinking of how we treat kidney stones. You know, the old-fashioned way is kind of on the top picture where you break it up into little fragments and then you pull it out. The new way to do it is called dusting. And dusting is really the preferred because you don't need a basket, which has a cost to it and there's some risk to it. It also decreases the amount of time it takes to do the procedure, and it improves the likelihood that it's going to get rid of the stone altogether, which is the point of doing it. So this is an example of what this laser can do. Here's a stone inside the patient. We've got the laser fiber out on the stone, and you can see what it's doing. Essentially vaporizing that stone, or we call it dusting it. You can see those little dust fragments. You know, the old way to do it with the less powerful laser would just basically break this up into bigger pieces that then you'd have to either pass on your own, or you got to get the urologist to basket it out. We know that dusting reduces large fragments, so doing the dusting technique helps to make it less than 1 millimeter particles. Doing a stone dusting procedure also decreases the likelihood of needing a second procedure. So it's more likely to get all the stone at the first attempt, and then doing the dusting procedure for the stone, basically it almost cuts the operative time for the stone in half. So whereas the case typically took 40 minutes, now it takes like 20 minutes to do it, which is all good for you. In addition to the dusting technology, there's a new technology called the Moses, and you'll understand why it's called the Moses. Remember, you know, Moses parted the Red Sea. So how does that work? I'm going to show you a video that explains, you know, that Moses works this technology at a greater distance than the standard laser system, meaning that you can deliver the energy over a longer area. And it also helps to prevent migration from the stone. So you have to think about the urinary tract. When we have a stone in the ureter and we've got a scope in and we're chasing this stone up the ureter because every time you hit it, it's going to bump it. Well, not so with the Moses technology. So another important part of doing the laser is less stone migration. And the top one is traditional laser, which is the problem you'd run into. You'd shoot the laser at the stone, but it'd cause it to move. Not so with this Moses technology, because it actually creates two air bubbles that parts the water, and then it actually makes it to where the stone is actually attracted to the laser fiber, so you can repeatedly fire the laser at the stone without having it migrate. So all this is fairly technical, but the bottom line is that it's better treatment and better care for you. So here's another example. You know, on the left-hand side is the traditional way we'd use to treat stones, and you can see how much movement there is every time you hit the stone with the laser, whereas on the right-hand side, you just point the laser to it, and the stone, because of the physics of the energy in the bubble that's produced, keeps the stone right at the laser. So it like I said, it reduces the operative time by about 50%. So it's really pretty amazing technology, and really only a few centers in Texas have this. Okay, so you know, to summarize, using the Moses reduces movement of the stone. It reduces procedure time significantly, and it's proven in a randomized blinded trial to improve the stone-free rate. Okay, so this is really amazing technology that we have here at Titus.